And we're talking about the top of the core. We're talking about the diaphragm, right? So that's why breath is so important both in Pilates and exercise in general. Because if the top of the piston isn't pumping correctly, if you're not breathing properly, it's going to affect the whole piston, okay, the way the whole system works. So that's why that diaphragm and breathing properly is important, okay? So that's why when we're talking about exercise and we're saying engaging from your core, those are the muscles, and that's why the breath is a part of that. Okay, so if I'm holding my breath and I'm not breathing, I'm not pumping the system. If I'm reverse breathing, if I'm exhaling and pushing my tummy out versus pushing my tummy in, or pulling my tummy in, pushing the air out, then I'm reverse breathing, and that can be an issue too. Why? Because then we're not engaging that transverse abdominal muscle properly, and then we're not engaging the core properly. So that's how that all works together. All right. So in Pilates, the breath is what they would call a lateral thoracic breath. So it is getting into the lower lobes of the lungs. It is helping you to expand your lungs from east to west. Okay, so that's what that looks like versus breathing just in the upper chest or breathing in the neck, which is what we would call accessory breathing. And it is different than deep diaphragmatic belly breath, which we might use a little bit more in yoga. So typically for exercise in general and for Pilates exercise, we are drawing in from our center, holding tight from our core, pulling the transverse abdominal muscle in, breathing from the rib cage to do the exercise. Pushing out the air, pushing out the air. So that's how that all works in concert together, all right? And one important part of that I want to emphasize right now is that breath. We want to keep our rib cage supple and our lungs expanding and breathing. It's really important right now. So you can practice any kind of breath, but that is the type of breath we would use with exercise, and it's a good exercise for moving that rib cage and expanding the lungs, okay, the lateral thoracic breath. So I want you to think about that, because that's also a part of having a good, strong immunity. Having good breath, having that circulation, that's all a part of that. So if you've got any questions, you know how to contact me, bfitpt.com.